case-based learning or interactive workshops and online resources throughout the curriculum. Okay, so let's go ahead and move on to our agenda. And I'm going to go ahead and put the agenda in the chat for everyone so that you have that in writing as well. So we'll begin today with Dr. David Sears providing an overview of the Introduction to Quality Improvement module and how to use the module. I'll follow David with a brief overview of the course structure and how to access the course. And then finally, we'll have time for questions from all of you. Okay, so now I'm going to turn it over to David, and he'll introduce the course.
Wonderful. Thank you so much for the introduction, Melissa, and really nice to have so many people in the Zoom webinar today. And I appreciate having a mix of those of you with STRIPE experience and those of you who are new to STRIPE. Continuing briefly just along the theme of thanks and gratitude, I really am really happy and excited to present this module to you today because this really came out of feedback from many of our partner schools, which are represented today, and some homegrown initiatives out of Makerere University in Uganda to create and strengthen some quality improvement workshops for learners from multiple health professions. And I think this was not having an introduction to quality improvement module in STRIPE in the first couple of years of the program, I think was really a gap in our curriculum. And there are a lot of people who came to us kind of asking for that, and we built it into some learning modules previously, but never had really had a dedicated module now that focuses on some of the core principles of quality improvement. So I think this module fills an important need and also is a product of feedback from a number of our partners, some of which are here today. So thank you. What I will do going through this module is I will screen share. The first thing I'm going to try to do, so I'll be bouncing between two documents primarily. So I'm going to see if I can how things look for all of you. If I share my entire screen and kind of move between these two documents, is that large enough for you to see, or should we really try and just go one screen at a time? So if you can just say, if you can see my screen share well, just please say yes. And if you can't, say no. And if we have a lot of no's, I may change the way that I share. But if you're able to feed that into the chat, I would appreciate it. So if you can see it well, yes. Okay.
David, we do see your Finder window, so if you don't need that open, you can close that.
Okay. Yeah, I may just minimize it because of how much I'm going to move between the two programs. It looks like, okay, we see a number of yeses. So I will at least try and keep these two documents in the foreground. And if there's trouble seeing them or you need me to move to just sharing one document at a time, I can do that. Thank you. So let's talk about the module then. So there are for those who are less familiar, as Melissa had alluded to, the STRIPE modules generally have been in-person interprofessional trainings. And so what that means is there's a facilitator or a few facilitators, ideally, in the room with individuals who are either training or many of them have finished training in various health professions backgrounds. So we've had a lot of nurses, clinicians, including physicians and clinical officers, pharmacists, healthcare administrators, et cetera. And the idea is to try to bring us together in a training to deal with important clinical problems in a way that's much like the care that we deliver when we are in our jobs, as opposed to kind of keeping us in silos. And so for those who have not facilitated, usually the STRIPE modules come with a facilitator guide. And so that's this document that we'll go through today. And the learners will have something similar. We'll not show the learner guide today, but the learners will have something similar that will show a lot of the goals and objectives and activities, but we'll have a number of areas of blank space for learners to answer questions and take notes. And then the learner guide will not have some of the facilitator specific notes. So the facilitator specific notes, which you may see today, will show in the facilitators, or will guide the facilitators in how they will teach the learners. So let's see. I will actually, let me just change the way that I share then. We'll just start by focusing on the facilitator guide. We'll go through this document, which is the facilitator guide. And learners will also have what we call additional learner materials, which may be further readings, it may be worksheets that they, or references that they draw upon as they go through the module, that also can serve as high yield references after they finish the module. In addition to that, we have, particularly if groups are able to project slides, we have a set of slides that the facilitators will use, sometimes to visually demonstrate either graphics or important learning points, and that will accompany the workshops as well. So the goal of this STRIPE module, it's very different than a lot of our prior modules, which were very focused for the most part on specific disease presentations or clinical problems. But the goal of this module is for learners to understand the role that both frontline health workers and local leaders play in evaluating and improving healthcare quality. So it would be wonderful if we could turn everybody into healthcare quality improvement experts at the end of this module, but really the goal of this module is to kind of sensitize learners to think about healthcare quality and what role they may play in delivering high quality care and improving quality of care. So each goal, the STRIPE module, will then be followed by objectives. So how are we going to meet that goal? And we have 6 for this module. It's a fairly ambitious module. We've put in some guidance in response to feedback about areas where we may be able to skip or pare down what we're doing, but we're trying to achieve 6 key objectives. And so that is really describing what comprises quality in healthcare delivery, appreciating your role in delivering high quality healthcare, defining the components necessary to measure quality, otherwise known sometimes as quality indicators, and appreciating how those indicators are used. Then number 4, understanding the use of quality indicators in the care of people with HIV, given our HIV focus and STRIPE. Number 5, learning some basics about how to investigate the root cause or causes of a low performing quality indicator. So maybe there's an area of clinical care that is not of high quality. How can we figure out what the reason is? And then learning at least one objective to trying to improve, or one framework for trying to improve quality, which is number 6 here. And that's applying the Plan, Do, Study, Act, or PDSA framework to improve healthcare quality and study its impact. Some of these concepts have been introduced at times throughout the modules, but really the quality improvement module does not assume that anybody has done any particular prior STRIPE training. This workshop roadmap is largely here for facilitators. It gives estimated durations or amounts of time for each of these activities and describes a little bit about the content that goes with each activity. I'll skip down here. These are some basic instructions for the facilitators about adapting the module to local conditions, how to set up the room, and what additional learner materials individuals may have. We also, of course, it's healthcare. We have to use abbreviations. We have many abbreviations, not that many for this module, but we've put them here at the top, and that is in both the learner and facilitator guide. One thing that's different is this module really introduces a lot of terms that may be new or unfamiliar for people who are taking the quality improvement module. So we've put in a glossary of key terms that are then really identified and defined throughout the module. But this is something that learners and facilitators can go back to and refer to. There is a lot of new content that goes into this module. And so we certainly welcome feedback about any aspects of the module, but if the amount of new content is overwhelming or too much, that's something that we would really want to know. But again, I think the main focus is sensitizing learners to their role and introducing some of these key concepts and giving them the resources to further think about quality. So now we get into some of the facilitator instructions. These are pretty standard instructions, just about an icebreaker and first activities and introducing the module as a whole. And I think this, again, this is different. We're not starting necessarily with one specific patient case like we do for many STRIPE modules, but we have an introductory, almost like monologue from the facilitator. This does not need to be read exactly as is, but I think really talks about how frontline healthcare staff can start to think about quality and quality improvement. And so I wanted to highlight a few things. Many times in our busy professional lives, and this certainly applies to me in my own HIV clinic, it's easy to fall in the habit of kind of fulfilling our daily job responsibilities without stepping back and considering how our actions fit into the broader health of our patients and the communities we serve. So, for example, frontline staff in a busy clinic evaluating and treating many patients with HIV may not actually have clear knowledge of the quality of care being delivered there, such as how many patients are virally suppressed. That may be readily available at some clinics, that may not be at others. What are the reasons for failing to achieve viral suppression? Are patients being hospitalized at high rates? Are these hospitalizations avoidable? Are patients receiving appropriate screening and preventive measures? Are patients satisfied with their care? In my own clinic, I can get a fair amount of that data, but it's actually surprisingly can be surprisingly hard to get a lot of it. And so I think the key, aspect of the sensitization in this module is that many times, the expectations of our jobs are related to the volume of care we provide. So are we showing up on all the clinics or hospital days we're supposed to be working in? How many patients are we seeing? Kind of how many people are moving through the healthcare system? But it really takes work to develop a skill set and a mindset that also prioritizes quality. In this module, we really introduce those basic concepts of healthcare quality and techniques that everybody can use to assess and improve healthcare quality. Um, I'm going to move just really quickly to the PowerPoint that kind of goes with this section. And this is a suggestion from McCary University. Really like this kind of idea of a module overview. And what we're doing with this module as we go through these objectives is we will start by defining quality, um, and then discuss how to measure quality, then look at tools for diagnosing gaps in quality, and then finally talk about how do we test change or interventions to improve quality. And so that's really what we're trying to do, are some really basic foundational building blocks. I'll move back to the Word document. And so this module does start with a clinical vignette, although different than other clinical vignettes. This is more a in the clinic, not a patient-specific vignette. And so we talk in this module, and this can be adapted to local contexts or conditions. We try to have healthcare workers imagine they're working in an outpatient clinic associated with a district hospital where you're treating patients with HIV, and your clinic has different days of the week dedicated to caring for certain populations. And today's clinic focuses on women's health. In the morning, you see a number of women with HIV who are pregnant, who've recently given birth, and each clinic day is busy. And during lunch, there's an all-staff meeting to discuss healthcare quality at the clinic. So then the clinical vignette, we won't read all of this, but we'll go through potentially problematic areas of care in the clinic, such as women dropping out of care following women with HIV who are pregnant, who then drop out of care following childbirth, and how we can design an intervention. So in activity one, this is describing what comprises quality. We introduce one definition. There are many definitions out there, but this is a definition that describes healthcare quality as being centered around these 6 core aims. Again, this is just for kind of sensitization and reference. So safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity. So if care meets all of these objectives, it should be high quality care. So as we introduce at least one definition of quality, we then ask learners to think about patients in this hypothetical clinic, particularly expectant mothers who are living with HIV. And working in small groups, the learner should then make a list of possible answers to these 2 questions. So the first one is kind of what needs to be in place for the clinic to be able to provide high quality care. And then from the perspective of the patients, what constitutes high quality healthcare? So very open-ended questions. Patients or learners can brainstorm answers to these 2 specific questions, and the facilitators will give them a few minutes to go through or to brainstorm, and then we'll bring the larger group together. And what we do then with the larger group at this stage is introduce a framework. And again, this is a framework among many for evaluating healthcare quality. And so one of the accepted, or probably most widely accepted framework is something named after a physician from about 60 years ago, named Dr. Don Abedian. And this is his model, which is widely used today for a framework for healthcare quality. So the idea is we need both high quality structure, process, and outcomes to deliver good care. And so structure is kind of we need medical facilities that have the right equipment, that have the right people or human resources working there. We need an organizational structure that values high quality healthcare. So we need all of that in place. That's kind of foundational to provide high quality healthcare. And then process is really, for the most part, it's kind of care seeking behavior. Are patients able to come in and access healthcare at the right times when they need it? And then what really happens at that clinical visit is the right diagnosis made and the right treatment. And then finally, the last thing are outcomes. Are patients equipped after they seek healthcare with appropriate knowledge? Is behavior changed if needed? Is their health status good? So did they avoid hospitalization? Did they give birth to an infant without HIV? And are they satisfied with care? And I think a lot of times we really think about this as quality, and that's very important, which is health status. But sometimes we forget that there are so many other things that feed into that, and patient satisfaction is key. The facilities, the equipment, the appropriate diagnosis is key. So we introduced this model, and there's also in the additional learning materials a 4-page document um, well, it's actually about 2 pages around the Donabedian model. Also, as I'm bumping around between these documents, I'm not keeping a close eye on the chat. So Melissa or Maeve or anybody, feel free to interrupt me if there's anything I should address now.
I got
So we have learners. Oh, was there something, Melissa?
No, just saying I'll take care of it. Thank you.
Oh,
Yep.
yeah, wonderful. And I'll take a look at the chat in a little bit, but thank you. So we give learners this moment to brainstorm what needs to be in place to deliver high quality care, and from the perspective of the patients, what constitutes high quality care. And then we introduce the Donabedian model or framework, and we ask learners in this activity to build out their answers to this question using this framework and see if they can expand upon their answers. And give learners another 10 minutes or so before we provide a sample answer. And so we go through the Donabedian model a little bit more and think about certain questions that fall into each of these categories, such as structure, process, and outcome. So there are additional questions, and the idea is to give people, again, just a framework for thinking about aspects of healthcare quality that go beyond just what we usually focus on, which are kind of patient outcomes. We'll get to that section next. So I'm going to bump back over to the facilitator guide. So there are sample answers in here for the facilitator if they want to add to answers that learners have given. And that's at least a summary of activity 1. Activity 2 is very reflective, very open-ended. So now that we have identified or provided a definition and some pillars of high-quality healthcare, and the framework, the Donabedian model, to thinking about healthcare, we really want to engender a discussion here in activity 2, which is to have each learner there to think about their health profession and think about the structure, process, outcome of high quality healthcare, and what is their role? Where do learners fit in within the scope of their profession? And hopefully, with some good facilitation, this will allow people to think about, oh, wow, these are my roles in the clinic, and this is how they fit into high quality healthcare, and these are some things I could potentially do to improve the quality of care in our clinic. So there are no right or wrong answers here, but just kind of a timeout after we've introduced a lot of new concepts to reflect and to share ideas. So into activity 3 now. In activity 3, we introduce the concept of quality indicators, which unfortunately have many different names, sometimes quality measures, quality metrics, et cetera. And so we go back to our clinical vignette, which the learners and facilitators will see. This is where the idea of women who are pregnant with HIV dropping out of care following their pregnancies is introduced. And in the clinical vignette, we describe the director of the clinic asking staff members if they've noticed a similar problem. And then the idea that the staff will then talk about an approach to this problem. So we introduce this idea, which is that many times the first step to improving quality is actually just figuring out how to measure it. And this gets, I will say, a little bit technical that maybe we don't have to necessarily get into details in a major way, but I do think it's really important that people understand the importance of quality indicators and how they're measured. And so that's what this activity focuses on. Um, and the idea is the measure, our quality indicator can measure and track some structure function outcome. And they're usually expressed as a percentage and used to indicate how close you or a clinic is to a particular goal or a standard level of quality. So for example, a structure quality indicator might be the percentage of days when the clinic was fully staffed with at least 5 nurses, for example. A process indicator, it's a percentage maybe of the newly patients diagnosed with HIV who are started on ART within a week. An outcome indicator could be the number of patients diagnosed with cryptococcal meningitis who are alive after 1 year. So just examples of quality indicators. So we then break off into small interprofessional groups again, discuss the clinical vignette, and determine how you would design a quality indicator to assess the retention and care of pregnant women with HIV following delivery. So in the discussion, we encourage people to think about quality indicators as a percentage. So how would you define the numerator? What group are you measuring? So we're trying to measure how many women are retained in care following delivery. And then how would you define the denominator? So what's the total group from which this numerator is drawn? And what are the trade-offs for your choices? So we give learners a few minutes to go through this. And then we have a slide along this line. So we give the facilitator answer here, which is, again, very basically kind of the number of women with HIV still in care following delivery divided by the number of women with HIV and pregnancy who are seen in the clinic. So what proportion of these women are in care following delivery? And there's, again, a slide that goes over this. And I think the important part is really it's how to clearly define the numerator and denominator in this equation in a way that can be consistently measured and compared over time, because we're sensitizing people to the idea that measurement is really important, because if we're going to intervene to improve something, we want to be able to measure what we do before and after in a consistent way. And so there are some trade-offs to this. So for example, for the denominator, it's who counts as being seen in clinic? Is this one visit during pregnancy? What if they're not retained in care prior to delivery? If they drop out, do they go into the denominator or not? If the patient is known to transfer care to another clinic, that's good. They're still in care somewhere else. Do we count those patients, et cetera? So there's some trade-offs around the numerator and denominator. We don't want people to get bogged down too much in the details, but we do think it's important for people to know how an indicator is measured and some of the trade-offs. And then finally, thinking about most quality indicators will need a time frame for collecting data. And so a short time frame may mean that we may classify somebody as having dropped out of care, but it's such a short time frame they actually haven't had time to come back into care, for example, or we may not get enough patients. So there's some trade-offs around the time frame too. So there are all slides that go with this that introduces this concept. And I think it's less important that people know exactly, the fine details of how to create these indicators and more of what goes into these trade-offs and decisions. So lastly, at least in this section, which I think is important, is it's really important that learners appreciate that having an accurate quality indicator can do a lot of things. It can determine if an area in care is truly problematic. Maybe we think this is a problem, but it's actually not as big a problem when they look at it. It can trend quality over time. It can allow us to set goals. And then it can, of course, measure the impact of an initiative. So that's activity 3, is talking about these quality indicators. And then activity 4 moves on to thinking about quality indicators in the care of people with HIV, and particularly in the clinical locations where learners may work. So we introduce the concept of the PEPFAR quality indicators, which were mandated reporting quality indicators for PEPFAR-funded clinics. And so there is an additional learner material, and I will open that and show that to all of you. So this is a list of quality indicators that was used in clinics that were funded previously by PEPFAR. And there's an indicator description. It doesn't go into the details in this document of numerators and denominators. I think that's too much. But it's around certain indicators such as the number of HIV self-test kits distributed, among other things. And so there is a document with 2 pages of healthcare quality indicators, and we ask learners to review these indicators and to think about where they work and which indicators here are important to their patient population, which are applicable to their patient population and where they work, and which are applicable to their health profession. So which are things that fall kind of within their healthcare responsibilities that they could work on, where they could work on improving these quality indicators. So this is really a discussion. It's to try to take the prior activity, which introduces this kind of abstract idea of like, oh, a quality indicator, and bring it home into people's health professions and where they work as well. So this activity, again, going through these quality indicators and trying to pick out ones that are important, and then the facilitator is going to facilitate a discussion around those indicators. Okay, couple more activities here. We have 2 more activities in the module. So activity 5 comes back to our clinical vignette. And now at this stage, we've created a quality indicator. We've started to look at how many women are retained in care following childbirth. And so now we kind of have that baseline data in our vignette. We say 71% of women are retained in care following childbirth. And so now we need to think about why are some women, why are 29% falling out of care? What is happening? And the key word that we use in there is why, actually, is that why? And so there are a lot of approaches out there for trying to get to the root cause of a problem. And one approach, which was introduced at one point in one of the other STRIPE modules, is a process called the 5 whys. And the idea is you look at the area of quality that you want to improve that's maybe short of standards, and you ask, why is that? And then from that why, you continue asking why. It's said, it's called the 5 whys. You can ask a little more, a little less than that, to try and get to the bottom of the issue and the root cause. And so the idea is, if you say, okay, we have 29% of women are dropping out of care after childbirth, why? Maybe you have a few ideas. Maybe it's that the clinic is located too far from where these women live. Maybe women don't have easy transport. Maybe women are concerned about taking HIV medications while in the postpartum period or while breastfeeding. So we come up with those potential answers, and then we keep asking why until we hopefully get to a root cause or various root causes for that. So maybe it's that for some women, after we ask why the first time, we have 3 hypotheses, and we take one of those whys all the way down as far as it can go. So maybe it's related to concern about HIV medications when breastfeeding. And so then why is that? Why are women concerned? Maybe they're not getting good sources of information in the antenatal period. Maybe there are rumors circulating in the community. Maybe they're aware of somebody who might have had a bad reaction to HIV medications. And so we keep asking why until we try to get down into the root cause. So this is a very basic concept to introduce to try to, again, identify why a certain quality indicator may be lacking. And so we introduce the 5 whys. There are a few slides with that. We give learners a worksheet that looks similar to this, where they can, in small groups, come up with a hypothetical reason and then ask why and why. Again, this is a hypothetical reason to try to come to root causes. We do say for facilitators, if there's an area that learners are already working on, we can adopt that. And if not, we can use the 5 whys from this clinical vignette. Then finally, so we have identified quality, or we have defined quality. We've talked about quality indicators. We have talked about a very basic approach to a root cause analysis. And so then the last step is, okay, we need an intervention that we're going to implement to improve quality, and we need to study that intervention. And so again, another very basic and I think really applicable way to do this is what's called the PDSA framework, or PDSA cycles. And so this is the Plan, Do, Study, Act cycle, and it's a framework adopted for quality improvement activities in healthcare. The idea is you plan something out, you figure out what you would like to improve, you use your root cause analysis, you design an intervention, you figure out how you're going to measure the impact of that intervention. So that's plan. You do, then you carry out the intervention, you collect data, you document problems and successes. Then you study it. So you study the impact of your intervention. That's why those quality metrics are really important. and what you learned when carrying it out. Then, based on that study, you act again and you continue these cycles. So now you make a plan for next steps based on what you've learned and start the improvement cycle again. So we introduced the Plan, Do, Study, Act framework. I will show you a couple of slides along those lines. There is also a worksheet that goes uh, in the learner materials so they can actually use the worksheets to do the planning part of thinking about their intervention. Here's the 5 whys technique. Um, and let's see, and then the Plan, Do, Study, Act cycles. So there are a few slides that introduce this concept in addition to the additional learner materials. And in small groups, the learners will go through their hypothetical intervention and talk about how they're going to plan for that intervention and then discuss the Do, Study, and Act portions. So at the end of the module, so that's the last activity, we do come back to this kind of module overview with a brief synopsis of what we learned for each of these concepts. So we've talked about defining quality and how that fits into the Donovan model. We've talked about measuring quality. So we've introduced the concept of quality indicators and measurements. We have discussed diagnosing gaps in quality with the 5 whys method. And then we've talked about interventions and testing change through PDSA cycles. So at the end of the module, we then come back to, we go through the overview. We always come back to the learning objectives, and we really give learners a chance to reflect on what they've learned at this point. And that brings us to the end of the module with a number of references at the end of the learner and facilitator guides in addition to the learner materials. So I've been talking for a while. I will stop there and turn it back over to Melissa. But I really appreciate your time as we went through this overview and really appreciate the feedback that we've received from a lot of partners, which I think has really strengthened the module and are looking forward both to rolling this out and receiving more feedback as it becomes operational. So thank you, everybody.
Thank you very much, David. All right, I am going to share my screen. And actually, before we get to what I'm sharing on the screen, you may be wondering, some of you have asked about it in the chat, how to get access to these materials and to the module. To get started with getting access to the materials, you'll just need to email Roger Lawrence, who's the LMS administrator for AFREhealth at rlawrence@afrehealth.org, and request access to the STRIPE HIV course website. Access to the website is available to all AFREhealth members. Thanks for Roger for putting your email in the chat. Appreciate that. I do want to tell you that all of the materials you've seen today will be available on the module. However, they'll look slightly different. We are putting the final touches on the formatting of some of the documents, and the module will be available in approximately 2 weeks by the end of this month. And once it's ready, we will ask Roger to send an email out to all members so that you'll know it's available. All right. So now, if we would take a look at what I'm sharing on the screen, I'm sharing the STRIPE HIV course website. For those of you who've not seen it before, this is what it looks like when you first log in and have full access to the site. It starts with an overview of STRIPE HIV, has information about how to use the course, and then it is followed by the modules. There's also some resources for facilitators and learners as well in the introduction. And you'll be able to look through all of that. There are 25 modules currently in the course. Our newest one is, of course, the Introduction to Quality Improvement module. And for all of these modules, including the Introduction to Quality Improvement module, learners will be able to get a certificate of completion through the course website as well. All right, so I'm going to put this in the chat so that you have it as well. The QI module is set up similarly to the other modules. As David said, normally our modules begin with a case. In this case, in this instance, it begins with a clinical vignette. And this one, as David said, is about caring for women with HIV. Following that is the pre-knowledge quiz. And the quiz here and in all of the modules is to help prepare learners for the topic, as well as assess their knowledge before getting started with the module. The next section is the workshop activity. And the workshop really is the primary activity for this module. It's designed for an in-person or online group training session. So while learners can read through the materials individually, it is intended to be a workshop that is for an interprofessional group of healthcare workers. You'll notice that there's a learner guide, which David referenced, and it looks very similar to what the final facilitator guide will look like, but it doesn't include all of the bells and whistles with the answer key and suggestions for facilitation the facilitator guide has. In the facilitator appendix, that's where you will find the facilitator guide. Also inside this folder will be the facilitator answer slides, and that's where you saw the great, the PDSA model and the Don Bedian model that David shared. Only facilitators will have access to the facilitator appendix. So you can see here it says hidden from students. Next, it will be followed by the post-knowledge check quiz. Again, this quiz allows learners to reflect on what they've learned, and it helps us measure the knowledge that the learners have gained. Lastly, there is a folder that contains additional learner materials. These materials are supplemental resources that support and expand on the workshop content for further learning. So that is the module. Before we move on to the question and answer portion of our webinar, I do want to pause and say thank you to our STRIPE HIV partners at Makerere University. They gave really valuable input and contributions to developing the QI module curriculum, and their expertise and input really strengthened the module. Now we'd like to hear from you. You are welcome to ask questions. Please type your questions into the chat, or if you prefer to speak, just unmute yourself and ask them directly. David and I will do our best to answer any questions that you have. I see that the QI team at Addis, excuse me, I'm going to mispronounce this, but Addis Ababa University is is one of our CQI partners, and is asking about having the materials. We will follow up. Maeve will follow up with you directly after the webinar. I'm going to make sure I take your name down so I don't forget it. Nellie says she's looking forward to the module in a couple of weeks. Thank you. We're excited about it too. And we've got some more modules coming on pandemic preparedness, surveillance, and communication during pandemics. So you'll be getting more information about those soon after the QI module is released.
I love the idea of trying to pair this module with homegrown or pre-existing quality improvement activities. I know that may not be the case at every facility, but that was one of the goals behind this, is to kind of create a learning learning module and an introductory approach to quality improvement that could go with homegrown initiatives on CQI that are already happening. So we will certainly try and get this out to everybody as soon as possible.
I think we'll leave another minute or so in case there's any more questions. And then after that, I'll invite AFREhealth's Executive Director, Mrs. Georgina Yaboa, to say a few words if you'd like. But let's give another minute if there's any other questions. Okay. Georgina, would you like to say a few words to close us out?
Yes. Thank you very much, Melissa. And I'm so excited about this module. One of the things that we talk about in quality, health service quality, it's accessibility. Accessibility. And accessibility is not only about the roads or the facility being there, but also the human beings who will be providing the service as well. And so I see what UCSF in collaboration with AFREhealth and then our funders are doing generally is also towards the healthcare. Why am I saying that? Because what STRIPE is doing is equipping the people to be able to provide a service. And so those who enroll in these programs are equipped to be able to provide a service where they are and where people will need a service. So the human beings will also be available. And this is wonderful about STRIPE, what you are doing. And we are very grateful to you and for all our partners who have also been inputting into the models, making the models wonderful for us. And I see that if people enroll in this, it will not only improve on HIV care, but the general health care as well that we are providing. And I always say that we are the beneficiaries of the care that we provide because we are also patients. No matter what, one day you become a patient and you want to receive quality of care. And so we should take these things seriously. And so we are very grateful to you. And I also want to say thank you to the participants and encourage them to go online. Now 25 modules. And what happens is that if you take one, you get your certificate. So you'll be able to show that you've undertaken this course. Take all the 25 at your own pace and become equipped to be able to provide the quality service that we are all looking out for. Thank you very much, Melissa. I see Maeve there. Unfortunately, the presenter, I didn't check the name very well, but we are very grateful to him. And to our Makerere partners, AFREhealth members, we appreciate you a lot for all that you've done to get us this far, and the implementing partners as well. Thank you very much, and back to you, Melissa.
Thank you, Georgina, for your thoughtful and kind words. And thank you, everyone, for joining us today. We appreciate your interest, and please reach out to Roger when the time comes in about 2 weeks for access to this course and the new module. Have a good rest of your day and week. Bye, everyone.
Bye.
Bye. Thank you.